As we wrap up our 3 hour special today, we're ending with Aaron Derfel from the Montreal Gazette, health reporter for the Gazette, whose story broke the CHSLD Herron scandal wide open. Aaron, feels weird to say congratulations, but without that piece, I don't think we would be having this conversation in the province right now. So my hat's off to you for busting this wide open.
Well, thank you very much, Dave. It it was a truly difficult story to write. My hands were shaking as I was writing it. Other journalists, have to give credit to other journalists who were pursuing this, but I was fortunate enough to speak to some plugged-in sources who gave me the real picture and the rising death toll, which challenged the suspiciously low official death toll and the reasons why this institution was placed under trusteeship.
That's the difference. There were other stories. I know CTV had reported it as early as April the 1st with our previous guest, Loredana Moulet. City TV had something as well. The difference was that your story reported that there were people that were dead in their beds for days.
Yes, exactly. That just the chain of events, the catalyst that there were patients. I reported, and it's not clear because I spoke with the head of the Jewish General Hospital, and he yesterday the premier mentioned that the catalyst for this was a patient arriving at the Jewish General Hospital from the Herron, a patient who had COVID. I had reported that it was a patient from St. Mary's Hospital. I spoke with the head of the Jewish General Hospital, Lawrence Rosenberg, and he told me it was the first time he had heard this. So we're still looking into the timeline. Regardless, what happened is that public health tried to reach the residents, had difficulties, hadn't been reported. So when they showed up, that's when they discovered this horrific scene where there had been a couple of patients who were already dead in their beds. They hadn't been recognized. There were patients on the floor. There were patients who had excrement on them. Patients who were so dehydrated, their mouths were so dry they couldn't speak at first, and the nurses were in tears. And this is what prompted the trusteeship. This had not been reported, as well as the fact that the workers effectively abandoned the institution. And yesterday, the premier confirmed this. That at one point he said abandoned, another point he said deserted, and then the rising death toll. Some people have asked how couldn't they have seen this, but there was a stream of funeral vans leaving the facility in the last 3 weeks, and a worker I spoke to at the Herron, who said, yes, we admit it. It was a bad day. That Sunday we left our posts. They were just fearing. They were fearing that they could be infected because they didn't have personal protective equipment. They didn't have masks. There were some workers who got infected. And I'm not defending by any means the decision to abandon the nursing home. But as a journalist, I was trying to get into their heads as to why they did what they did. And for them, it was a decision: should they protect their family, or should they protect these people in the residence of the home? And unfortunately, they chose to leave. And it just demonstrates just how serious this issue had become. And I guess the bigger issues of lack of supervision in these private nursing homes, and the shortage of personal protective equipment during a pandemic.
We're in conversation with Aaron Derfel from the Montreal Gazette, health reporter for the Gazette, who broke open the story of the CHSLD in Herron, in Dorval, CHSLD Herron, where 31 deaths have now booked in the last few weeks. Are we expecting some sort of a reveal from the government as to what the 25 who, we've heard that 6, I believe, have been related to COVID, and the other 25 have not been confirmed yet, right?
Yes, exactly. So I've been, it's a credit. I have to give credit where it's due to the minister, to Daniel McCann. After we broke our story in the Montreal Gazette on Friday afternoon, within hours they got a court order. They went into the Herron with and they got the keys. They opened the doors to the offices. They looked through the patient files, and to their great, shock, they found out that the death toll was 31. So I've been writing these daily, almost nightly Twitter threads, and one of my Twitter threads yesterday was, will we ever know whether these, what was the fate of the other 25 who had died? I was told that on any given month, because it's a CHSLD, and you have some people in the late 80s and 90s that, unfortunately, it's not unusual that they report 3 to maybe 4 deaths a month, but not 30, 31 deaths in 2 to 3 weeks. So today, the government announced that they're holding an inquest. I don't know, there are varying degrees of inquests. There are public inquests, but the government announced that a coroner is going to look into this and look into the deaths at the Herron. So that's good news in the sense that it will shed light on what happened. And this has now become tragically historic. So for the record, we need to know what's happened. I doubt that those people who had died were tested for COVID-19. The only way to know for sure is to carry out an autopsy, and that might be, logistical in a number of cases because it might be buried, and so, it's just it's a big mess. Any way you look at it.
Aaron, you tweeted something last night that struck me. It was a thread, and you've been tweeting these incredible threads about the rise of COVID in Quebec and in Montreal. But this was, I'm going to read it. You wrote, "It's a sad commentary on our society that the law of omerta still prevails in Quebec's healthcare system, with patients and professionals often scared to speak out against abuses, as they did in telling me about the Herron. Perhaps this might change now, but I doubt it." Do you think we're going to hear more stories like this in the coming days and weeks?
Oh yeah, no doubt. I mean, and this is something that I had, alluded to in a tweet as well. That a shout out to all the reporters who are exposing abuses that are going on in the system now during the pandemic, and who are asking the government tough questions. So a moment ago, I was, praising Health Minister McCann, but I think it's appropriate to raise questions about the way things are being handled. I mean, clearly, in this pandemic in Quebec, the government, in retrospect, obviously miscalculated and devoted more resources to acute care hospitals and less to the long-term care centers, and everyone knew that these fatal outbreaks are occurring in these long-term care centers. So that raises the question: why did the government assign more resources earlier on to these long-term care centers? That's a legitimate question. So I do expect that my colleagues will to continue to report on this as they should. The question here is, as I said, the law of omerta that prevails in the healthcare system. These sources who spoke to me, I had written something in an earlier version. It was online. I'm not going to say what it was, but the source was worried that I had to subtract one little word. The story had already been online, and the source was worried that I could get back to that person. So people are scared. The worker who I spoke to, who admitted that her colleagues had deserted the place. She didn't want to obviously speak out, and I mean, sorry, to have her name attached to this, and now it's going to be probably a little bit more difficult in this particular context, in the Herron context, because there is a police investigation. So we're talking here about potential criminal charges.
Right.
So, but in general, this has lasted for a number of years, and some people can trace it back to the previous, government under the former health minister Gaétan Barrette, who launched this sweeping reform, and under this reform, people were not allowed to criticize, and this kind of omerta is still in the system, and that's why we have to redouble our efforts as journalists to reach out again to shine light on problems in our system, not gratuitously, but to raise this in the public interest so that the system improves.
Aaron, thank you for your time today, and thank you for all of your wonderful hard work on this story.
It was a pleasure.
That's Aaron Derfel. Follow him on Twitter at Aaron_Derfel, Derfel. Aaron is a healthcare journalist at the Montreal Gazette.